Michigan Department of Health and Human Services recorded on Wednesday of this week, yesterday, 4,453 adults and 114 pediatric patients hospitalized with confirmed infections in the state. About 83% of the state's inpatient hospital beds are occupied across various health systems, including Henry Ford Health System here locally in metropolitan Detroit. And joining us now to talk about the impact, the continued impact of COVID-19 on our hospital systems is Dr. Manu Malhotra from Henry Ford West Bloomfield Hospital. He is their chief medical officer. Dr. Malhotra, thank you for being with us again.
Thanks, Tyler. It's good to be back.
Appreciate having you on. So Henry Ford Health System announced their hospitalizations actually have decreased to 499 COVID-19 patients from the previous 551 new hospitalizations as of Monday this week. Does it seem like this most recent surge with Omicron is starting to take a turn back in a better direction, or are we just at kind of a stagnating point before the next hit comes along? Based on what you're finding so far and from your other colleagues across both Henry Ford Health System here locally and other health systems in Michigan and the U.S.?
Yeah, it's a good question, and I think everybody's asking that question right now. I think it's certainly appears to be that we have hit the peak. Hopefully we won't keep going up, but there's at least some evidence to suggest that we are at the peak, if not necessarily, well on our way to improvement. But I think what the numbers that you mentioned are noticeable. I'm looking at the number of patients that are in the emergency department, the number of patients that are waiting for beds to open up to be admitted to the hospital. I'm looking at a lot of the indicators of strain on the hospital systems, and there is a bit of easing on that. I don't want to break out the champagne just yet. I think, this is like kind of like, I just read a great analogy to this. This is like hitting the high water mark, but it's not until the water recedes that things actually go back to normal. And then the water certainly hasn't receded yet. The hospitals are still heavily booked with COVID patients. And, across the state and across the nation, you're seeing ripple effects of that. And those ripple effects aren't just longer wait times for acute care. It's also for surgeries being canceled and all sorts of other care being impacted as well. So that's the situation. Slight improvement. Hopefully this is a trend, but probably need to hold on and watch a little bit longer before we can say a whole lot. I've seen a lot of models around how we're expecting this to play out, widely divergent models. But from what I'm seeing, I would think that maybe by the end of January, beginning of February, we should see some significant easing of this surge at least.
And so we've heard at various points throughout the pandemic when we've had these surges in cases, when we've had a surge in hospitalizations relating to those surges or as a result of those surges or both, about the impact and the pressure in particular. That's the word we hear all over and over again, is pressure that it puts on our hospital systems. I'd like to go at this from a couple different angles. Firstly, when we have these surges in cases and we have hospital beds, inpatient beds, and bleed over into emergency room beds and so on that are filling up in our hospitals, obviously the care and attention that's going to be given to patients isn't going to change. That effort is still going to be there, but it makes the job a lot more difficult. On the COVID-19 front, for your COVID patients, when your hospital systems are so occupied, when the hospital beds are so occupied, and then you run into issues as well with staffing, when staff on the medical side and other adjacent areas in the hospital systems are affected by COVID-19, how does that affect the ability for a hospital system at an individual point or across the board to address the COVID-19 patients that are in their hospital and others in the local area that may need to be in that hospital?
Yeah, it's absolutely the crux of the issue. This makes me think of this concept that, maybe Omicron's a blessing because it's a bit less severe and it's highly infectious, and maybe it's helping us get to some herd immunity as a community widely. There may be some potential benefit there. The problem ends up being if there is no healthcare system that can be overwhelmed, if you're in some area that is so underserved that there's no other way to get vaccine or treatment, that's fine. Here, what ends up happening, even if it's less severe, the denominator has become so big that the absolute number of admissions is still just as high, and it crowds out all the other care, and we actually end up having mortality and morbidity associated with routine and emergent care for other issues that we can no longer provide. So, I always want to take it back to the idea that being vaccinated, being boosted is absolutely the right thing to do. It is effective, and I'm sure that we're going to talk about that a little bit later. But as far as what does that strain look like in the hospitals, and then how do we move forward and continue to provide the care that's necessary? This is a daily calibration of our capacity. So there are on each campus incident commands set up so that we are actually looking at daily cases, the daily number of boarders in the emergency department, the daily volume of cases coming in the ED, the number of beds that are full, the number of staff that are calling off, that we are short, that may be exposed, and all those exposures are happening in the community. So that is something that each campus is doing on a daily basis. And inpatient beds are required to do inpatient surgeries. So if inpatient beds are under a ton of pressure, there's decisions made sometimes to postpone inpatient surgeries that can safely be postponed. Those cases that are emergent, urgent, time sensitive, and need to be done will be done, and we'll accommodate that in any way possible. But, West Bloomfield has been fortunate that we've not had to postpone cases. We've been able to accommodate our surgical obligations to the community, but it's just by the hair of our chinny chin chin. I have to give a lot of kudos to our chief nursing officer, that's Stephanie Roberts Newman, and the entire nursing team and the rest of our ancillary staff and physicians for going above and beyond. So many of them are working overtime to make sure that we can keep beds open. And there's across the state and across the country such a shortage that while we have patients waiting in the ED, there's not enough staff in the hospital to even staff the beds that we do have sometimes. So, we've been very lucky to be able to continue to provide those services. And it is a daily struggle to make sure that if this area is short, can somebody else come in and support that? Can we do out an emergency call and get somebody in to come in? We've relied on agency, much like every other hospital in the area. Critical pay. It's just that 2 years into it, it's difficult to keep going back to the same well. And people are just running on fumes at this point. So I really do appreciate the opportunity to say something, and thanks to the folks that are fighting the fight every day on the front lines.
Yeah, and the people have continued to do so throughout this pandemic, who have joined in on the fight on the front lines throughout the pandemic at any various point. They've been under this pressure so many times that on one hand, it's a blessing because they know what to do when we get to this situation, but it's also a continuous negative that reoccurs because we keep having to get back to this point for one reason or another. We're joined by Dr. Manu Malhotra. He is the Chief Medical Officer at Henry Ford West Bloomfield Hospital, joining us on the MegaCast. And of course, with the Omicron variant, as you said, it seems that the results have been, the symptoms may not have been as severe, but the contagiousness, the rate of spread of this particular variant has been a much greater challenge than we've had with Delta and that we've had with other variants previously of COVID-19. And that's partly been one of the factors that's gone into the rise in hospitalizations and some of the pressure that's ultimately amounted on our hospital systems. But throughout this pandemic, we've heard more and more about, of course, about the personal risks that we take if we are affected by COVID-19, if we're exposed, if we are COVID-19 positive, especially for those that are unvaccinated, but also for those that are in at-risk positions that may be in need of emergency care, that may have respiratory issues, that may have other underlying health issues. And those people are also hospitalized, along with those that are COVID-19 positive. And while precautions are obviously taken to ensure that patients that are coming in without a COVID-19 positive, without being COVID-19 positive or not being exposed or not going to be positive for that, their care is also heavily affected. Can we touch a little bit, at least, on just how much a surge like this affects the timely care and the effective care of others that are also at risk, not only because of COVID-19, but because of other ailments that they're going to the hospitals for, or that they may need treatment for severe in the moment, or timely for down the road.
Yeah, no, absolutely right. And just as I was mentioning about surgery specifically, there are many hospitals that are having to cancel their elective surgeries altogether, or at least significantly postpone them. And just because something is an elective scheduled surgery doesn't mean that there isn't going to be some discomfort or downside to postponing. I mean, knee replacements are, an elective surgery, but that's actual pain and discomfort that somebody will prolong because of that. When the emergency departments are overly full, that directly increases the amount of time it takes to get care. That just creates a longer queue, and that doesn't matter in some cases, and it can matter in other cases. And we have a very robust triage process to make sure that we're able to identify the people that can't afford to wait. But what we're looking at there is a threat to life and limb. But there are people who are in pain, and people who are in threat of life and limb are being prioritized over them. And because everybody is stretched a little bit thinner, there are delays built into that. So I think we just have to acknowledge that and really be a bit cognizant of the fact that we should only be using emergency departments for emergencies right now. We've had some patients coming in to get tested for COVID without exposure, without symptoms, because they're getting ready to go on vacation. And it doesn't seem like that big of a deal on an individual basis, but when you start aggregating the time and manpower that it takes to handle that, it is an absolute, just absolute added stressor on an already distressed emergency department situation. So I think everybody's asking to make sure that we're really only going to the emergency department for what we think are emergencies, not for convenience. The things that can be handled in urgent care or an outpatient clinic setting should certainly be prioritized to be handled that way.
We're joined by Dr. Manu Malhotra. He is the Chief Medical Officer at Henry Ford West Bloomfield Hospital, joining us on the MegaCast. And of course, Dr. Malhotra, beginning earlier on this week, people were able to register online to receive free testing kits in all homes here in the U.S., up to 4 kits total per residential address via the federal government. And there also have been discussions on plans to send out N95 masks as well in some cases. What are your thoughts on these two actions being taken by the federal government and the potential impact that these can have on the local level specifically, but also across the board in preventing further spread of COVID-19?
Yeah, so I think, it's essential to know what your, COVID status is if you have had an exposure. So I think having easy access to tests is pretty essential. I don't know how much of a long-term impact 4 tests per family will have. I think the jury's probably still out on that, but having easy access or any access to testing is pretty meaningful. It's meaningful for people who are being responsible enough to require testing before they're gathering, if they are gathering, which, right now we certainly are not recommending large gatherings at all, or for people who have had some sort of respiratory complaint, they feel like maybe they have a cold. Well, Omicron sometimes looks like a cold right now. And instead of just sort of shrugging and figuring, I'll just make sure I wash my hands and keep my mask on, I think it'll create a little bit more safety and peace of mind to be able to test and be able to answer that question. Now, the tests aren't 100%. I think that's just something to acknowledge. But for people who have symptoms, for people who are making sure that they are following the instructions exactly, they are pretty effective. For people who are asymptomatic or people who are not doing a good job of following those instructions, yes, the sensitivity drops off significantly. But I think having knowledge of our COVID status, if we're having symptoms, is pretty essential, and it probably will stop spread. And the N95s are difficult to get in the market right now. So I think especially for the immunocompromised and elderly, people who have a lot of comorbidities, if they're in enclosed spaces, it's not a bad thing to be able to have access to N95s.
We're joined by Dr. Manu Malhotra. He is the Chief Medical Officer at Henry Ford West Bloomfield Hospital with us on the MegaCast. Dr. Malhotra, just a couple more minutes with you before we'll say goodbye at this time. Is there anything else right now that would be important for our audience to be considering in terms of how we can help our healthcare workers on the front lines, or hospital systems in particular, continue to battle COVID-19, or anything else on the COVID-19 front or on the medical front that we should be keeping aware of at this time?
No, I appreciate that. I think number one, as I mentioned a bit earlier, is to you just really be a bit more discerning about what's going to the emergency departments. That is really the biggest pain point right now, and really the highest risk area. So making sure that non-emergent complaints are taken to other venues is really something that we can do to make sure that we're keeping those emergency lanes open for the people who need them most, and those are our friends and family. The other thing that I will say is I feel like I definitely want to address this thought out there that maybe vaccination isn't as effective as Omicron. And even with the data that we're looking at in our hospitals, when you look at people who have vaccination and boosters, they have a vanishingly small number of admissions. There are people who were vaccinated who are getting admitted, but if you got boosted, those numbers go down significantly. And when you look at the people who are admitted, who were boosted and vaccinated, they are people who have very significant comorbidities, lots of medical problems, otherwise immunocompromised. Those are the people that would continue to be at risk despite those precautions. So I would, again, really reiterate how essential it is to get that added protection with vaccination if you haven't had it, and a booster, absolutely. If you have had your vaccine, it is making a huge difference in the Omicron experience. And then if you have already had COVID, the amount of added protection you get between having had the infection and the vaccination is the highest amount of protection that you could have. But people are getting COVID more than once, so don't think that you've got it once and you're done with it. Immunity starts waning after a while, and two, as these variants change, it's valuable to have both the vaccination and the innate immunity, because they both work slightly differently and provide an added amount of protection. So again, I'll just emphasize the importance of vaccination, wearing masks, and hygiene, and really avoid large gatherings in indoor settings, at least until this surge is in a trough.
Dr. Malhotra, thank you very much for your time. Thank you for giving us more insight into how COVID-19 and this recent surge is continuing to affect our hospital systems.
Thanks for the opportunity to talk to you. Have a great.